Hi, everyone. Welcome to the channel. Thank you so much for joining me this afternoon. I'm so excited about today's live stream. We're just going to jump straight into things. And we're going to be looking at the Depo birth control shot or injection and its side effects. There's a lot of concern about using this method of contraception. And I thought it was good for us to look at some of these concerns, look at what the really harmful side effects with the Depo shot or the birth control shot are, and compare them to what we know from studies, where we have studies that have been done, compare them and see where is the middle ground. Should we be scared to use the Depo shot? Should we be concerned about its harmful side effects? Or is there a kind of hype going on about the Depo shot? What exactly is it? But there is a lot of concern, and I just wanted to see if we can balance things out. I searched on the internet and I went on social media to find the most common symptoms and concerns that women have about using the Depo shot, and we're going to look at many of them. There are loads. I can't get through all of them, but we're going to look at a good number of them. But before we get into that, I'm Dr. Sylvia. If you've not met me before, I'm the founder of AskAwayHealth, a platform where we share health knowledge and information. I'm a general practitioner and a fellow of the Royal College of General Practitioners. So I've been practicing for a pretty long time, practicing medicine, that is. And I'm also a diplomate of the Faculty of Sexual and Reproductive Health. So I do have an interest in women's health and things to do with sexual and reproductive health. And I love creating YouTube videos because I think it's a great avenue to share my knowledge and experience and help educate us about things to do with our health and wellness. And that's what AskAwayHealth is dedicated to. We're providing simple health information online. So we want to know about things to promote our health and prevent illness. Visit our website, our blog on askawayhealth.org. We've got social media channels, so you can find us on Twitter, Facebook, Instagram, our Google page, LinkedIn, all AskAwayHealth. So please check out one of those. And if you haven't done so already, come and say hi, subscribe, follow, like, you know the drill. Right, so today, our live stream is sponsored by one of our health partners, nalis.com. Nalis is a new online store. I'm just going to share a little bit with you. Let me know if there are any issues at all with the live stream. Please let me know if there are issues with the audio, if there are issues with the video as well. Please let me know, because last week we had some issues and things managed to go all right eventually. But just let me know if you're having issues seeing me. So I wanted to introduce you to Nalis. It's an online store, health and beauty products, as well as sports, wellness and fitness accessories. You can check them out on www.nalis.com. Today, they're partnered with us and they want to give away 2 of their products to 2 lucky winners in our Friday giveaway. So that might be you. And I'm going to tell you a little bit more about how that works. So they are going to be giving away 2 fruit infuser water bottles. So these are 900 ml BPA free fruit infuser water bottles. If you've not heard of fruit infusion, it's a process of gathering the flavor of fruit into plain water. So it turns your plain water into a delicious, healthy drink without spending any extra money. So these bottles, they look really cool, don't they? But yeah, pop some fruit into the infusion rod. It's got a large full-length infuser rod and you put your fruit in there and fill up the bottle with water, leave it over some time, sometimes up to 24 hours. And by the time you get your drink, your water is infused to the very last drop and you get the best flavor possible. So these are great for home. You can use them in school, office, for travel, for picnics. They are lightweight and easy to carry. So you might be in the reckoning for one of these videos, my friend. Okay, so let me just have a look in the comments. Hello from Carlene Dyer. Hi there, Carlene. Thank you so much for popping in today. Let me get rid of this video. I think we've seen enough of it already. Oh, gosh. Right. Okay, so get back into... Okay, there we go. So get back into the get back into the stream. So yes, now to win, let's talk about how you can win. If you're on the live stream, we need to get to 20 likes, at least 20 likes on this live stream. So please like the video if you're on right now. And as soon as we get to 20 likes, then I'll ask the competition question, which will be on today's topic. And the first 2 people to provide the correct answers will win one of these bottles. So that's how easy it is. Let's just get to 20 likes, please. Tag anybody who you think might be interested in watching this video. And let's try and do this today. But let's get into the topic. So we're looking at the Depo contraceptive injection. It is the Depo progesterone, contains progesterone. So it's an injection that is used to prevent pregnancy. And the most common way it's used is you get this injection 4 times a year, and it prevents pregnancy. So it's a planned, a regular contraceptive method. It's discreet. Some of them can be given by the individual. So if you get some of the prescriptions, you can actually give it yourself if you're properly trained. And if you have somebody at home who can be sure that you're not going to suffer any severe reactions to it, then you can give it to yourself at home. It doesn't interfere with sexual intercourse. So there are some benefits to having the Depo contraceptive injection or the Depo shot. It contains progesterone, so it works primarily by inhibiting or suppressing ovulation, which is the release of an egg from the ovary. Some of the other ways it works is that it could have an effect on the mucus within the cervix, which is a part of the womb, the first part of the womb. And because it makes the mucus a bit thicker, it reduces the ability of the sperm to travel very well within the mucus, and so reduces the chance of the sperm meeting the egg. So that's another way it can contribute to preventing pregnancy. Plus, it could affect the womb lining, the tissue of the womb, the upper lining, and make it unfavorable. So assuming the sperm do get to an egg and do fertilize, it prevents that egg that's been fertilized from planting into the lining of the womb. So it can alter the lining of the womb to make it unfavorable for the fertilized egg to plant into it. So now, usually we recommend starting the Depo injection if you're going to have it within the first 1 week or 1 to 5 days of your menstrual period if you have a regular period. So if you do that, you would have contraceptive protection by the end of that first week. So it takes up to 7 days to suppress ovulation and give you contraceptive protection. Of course, if you're not able to do that, you can still have the injection any time of the month, as long as you use extra protection for 7 days. Now, this is different for women who have just had a baby. If a woman has just had a baby and she's not breastfeeding, usually within 5 days, you can start the method, that is the injection method. If you are breastfeeding, we recommend that you wait for 6 weeks so that your baby's immunity and enzymes mature and they're not susceptible to the effect of the progesterone. So what am I saying? It can be used for a woman who's breastfeeding. It's just that there are precautions taken about when it is given, different to a woman who is not breastfeeding. Now, so who can use it versus who cannot? Now, generally, because it contains progesterone, a woman who does not want to use estrogen, which is what you get in the combined pill, or who cannot have estrogen for health reasons, is suitable to use the progesterone injection. That is the Depo shot. As I've just said, it can be used in women who are breastfeeding, with babies who are 6 weeks or older. Women who've just had a pregnancy termination or who've had a miscarriage can also use it as a regular form of contraception. But there are a group of women who medically cannot have it. So these are absolute no-nos. They cannot have this method of contraception. For example, women who have heart problems, severe high blood pressure, who've suffered from a stroke, or who have a very high risk of stroke. Excuse me. So they may also suffer from heart conditions like angina. So there's a risk of severe heart disease. Women who've had cancer, breast cancer, liver cancer, or women who've had severe liver disease. In addition to that, there are women who suffer from vascular problems, and those are problems that affect the blood vessels, and particularly women who may have had deep vein thrombosis, blood clots within their limbs, within the blood vessels in their limbs, their arms or their legs, anywhere else in the body. In these particular women, this method would not be recommended. So that's an absolute rule. that women in this criteria or in this category should not be having this method. Okay, so I'm just going to be popping back to and fro back into the chat from time to time just to make sure I don't miss any comments, or if anyone's coming in. Thank you so much for joining on the stream. If you've got any questions, please feel free to ask. I will keep checking into the chat from time to time, so feel free to pop in and ask a question if you're on. Okay, so like I said, I went looking at the different possible concerns or complaints that women could have when it comes to the Depo shot, the birth control shot, and I came up with quite a few. And I'm not going to go through all of them because there are loads of them, but I do have quite a number. So let's just get started. I'm going to bring it up and let you see on the screen. And I wanted this to be, yeah, okay. So we let people know that we're doing this live stream, doing this giveaway today. Okay, so the first thing we're going to tackle is a woman concerned about having the Depo, a dark brown, smelly vaginal discharge on her Depo shot or after the Depo shot. This is not very, very common, but when I check the studies, there are some women who can develop inflammation of the vagina and they can develop vaginal infections. And there's small risk of it happening a little bit more because they're on the Depo injection. So it's not a direct link, but it could happen. And in this case, a woman might come and say, oh, I'm on this injection and I've been getting this type of discharge that's brown or it's smelly. The important thing is to see your doctor to look at having tests to work out what the cause is, and of course the appropriate treatment. Because remember, an abnormal vaginal discharge may be a sign of a sexually transmitted infection. So I would expect, or I will be doing swabs to check out the cause for this discharge if you came to see me. But the other thing that's important, and we will touch on this a bit later when we're talking about one of the other side effects for the Depo shot, is the possibility of cervical cancer, because there may be an irregular or abnormal vaginal discharge. It may be bloody, it might be a different type of color, but that may be one of the signs that there's some change going on in the cervix. And that's why it's important not to ignore this dark brown smelly discharge while you're on the shot. Do speak to your doctor about it because it might indicate a problem. We do need to do tests to work out what's going on with regards to the discharge. Okay, so that's the first one that we're looking at today. Next, let's have a look at bruise, Depo Shot Bruise. So this is an interesting one and very, very common. And I left it as bruise, but actually it covers a whole range of different things because you're talking about injection site reaction. That's the most common cause. Remember we said at the beginning that it's a method of contraception where you get it 4 times a year. Now, there are different types. There are the doses that contain 150 milligrams, some contain 100 milligrams of progesterone. Some are given every 12 weeks, usually. Some can be given every 8 weeks. Roughly and more commonly, you get the shot where you're getting your injection every 3 months. So that's 4 jabs every in a year. That could mean for some women, they would experience bruising, they would experience scars, changes to the skin where the injection is being given. Of course, it's important that the injection is given in a different area from the last one. So if you had your previous injection in the right bottom or in the right thigh or shoulder, then it's the opposite side or some other part of the body that should be used next time to reduce the chance. But women do complain a lot about experiencing bruising on the Depo shot. Nearly 1 in every 10 women who get the injection could have this complaint. It tends to be worse when a woman gets it in a subcutaneous, that means directly going underneath the skin compared to going into the muscle. And yes, the injection can be given either directly into the muscle or under the skin. So it depends on the particular preparation that you're getting. But the studies suggest that women who are getting it under the skin tend to have or suffer worse with these sort of skin injection site reactions. So don't forget to get on top of that or to get away from that. The important thing to do is to make sure that they are being given alternately. Okay, so let's look at the next effect we're going to talk about. And I think this one is has a lot of people sort of buzzing because it's looking at the effect of the Depo on sexual drive, sexual desire. And what is the truth? Does the Depo affect libido? Does the Depo shot mean no libido or no sexual desire while you're taking it? So, yep, I went searching in the studies to see what they show. And there has been some link between the Depo and reduced sexual interest. So between the Depo injection, the progesterone injection, and having a reduced sexual drive, there has been some studies demonstrating some association, but not a direct link. So you know the way we say smoking can cause lung cancer, you can't say that the Depo categorically will cause a reduced libido when it's used. But there are associations. There are some studies that when they look at and compare, the women who are complaining of reduced sexual drive are using the Depo. So you cannot disregard that association, because it is a very common complaint. And so I think what we should be doing in that instance is looking at other possible causes. So if you came to me and you've been on the Depo, had a couple of shots or 3 shots or so, and you think that there's been a change to your sexual desire, then we should be looking at other possible causes that could explain the loss in sexual desire before we conclude that it's the Depo that's responsible. But I think there also need to be other studies to help us consider if there's a tighter relationship that we should be aware of. So that's where the studies are in respect of this at the moment. Okay, so where are we now? Let's look at the next one. And this is about the Depo shot with causing an increase in appetite and weight gain. Yes, again, another really exciting one. And when I say exciting, I mean it causes a lot of concern. This is a reason that a woman might decide she's not having the Depo, or a woman might decide to come off the Depo because she thinks she's gained weight. So is there truth in it? It's a very, very common complaint. And yes, there has been some association. Studies have shown association between the Depo and putting on weight and affecting appetite. The studies, interestingly enough, have also given us a little clue who's more likely to be affected. So what I found was that the weight gain is more likely in somebody who's under the age of 18, who is already overweight when they start taking the Depo. So for somebody under the age of 18, whose BMI is high or who's already overweight, and they start getting the Depo injection, they're more likely to gain weight. But in older women, so above the age of 18 and going up into the 20s and 30s, women who are thin tend to put on weight, are the ones who tend to gain weight. So actually, if you're over the age of 18, going into your 20s and 30s, and you're already overweight, and you start the Depo, is not likely, or is less likely to make you add more weight compared to a lady who's in your sort of same age group and who is thin. So it can be used by a woman who's overweight, but it's important that you do know the possible risks. Doesn't take away the responsibility from us to make sure that we continue to remain well and eat healthily, simply because we think, oh, the Depo is not going to make us put on weight. There are studies that show that it can affect women's weight gain, affect women's appetite in some cases. The studies also suggested that women who've been pregnant and had babies tend to put on weight with the Depo compared to women who have not had children. Right. If a woman experiences an increase of more than 5% of her body weight after starting the Depo within the first 6 months, so that's the first 2 shots, and she gains weight and notices that it's up to 5% of her body weight, she's likely or more likely to continue to gain weight. So that is the kind of person for whom the Depo, she's interested in controlling her weight, should really come off the Depo, because you're more likely to continue gaining weight. So I think that's useful. Within the first couple of shots of the injection, keep track of your weight. If you are gaining weight and it's up to or more than 5% of your body weight, that's the clue that you may be more likely to put on weight and should help guide the decision about coming off the Depo injection. Okay, so I want us to make really good progress with this so that we can hopefully cover as much of the points I've got here. So the next one is about getting the period or not getting the period. And I think this is probably the greatest issue in my search. I think bleeding abnormalities or irregular bleeding is the biggest issue. And the bottom line is that a change to the bleeding pattern, an altered bleeding, is very common with Depo use. And it's a big reason for stopping or deciding not to go on it, because you hear of your friend or your sister or your mom who had a nasty experience with floods and floods of bleeding, or very heavy, painful bleeding, or irregular bleeding. So you don't know when you're going to have your period. You're spotting today and nothing tomorrow, and a couple of days later is spotting or flooding, different things. So there might be infrequent bleeding, spotting, bleeding for a long period. That's a common one I found, is bleeding for weeks at a time. And that can happen with the Depo shot. It tends to be more frequent with the first 2 or 3 shots. So within the first year of taking the Depo shot is when you can expect the irregular bleeding pattern. But what happens is, as you come towards the 3rd or 4th shot, the bleeding pattern changes to less bleeding, or actually no periods. So what happens is, by the time you've been on the Depo for a long time, you've had your 4th or you're going into your 2nd year, you may actually be having lighter periods or no period at all. This is what is commonly associated with the Depo. I think the most important thing is that we warn women, so as clinicians, whether we're doctors or nurses who are giving the injection, it's important to let the woman know what to expect. And it's difficult to predict. That's the other thing. It's difficult for me to look at you or your medical history and say, okay, you know what, you are going to have really heavy bleeding, or you're going to have irregular bleeding. We don't know. We can't tell. But letting you know ahead of time that this is what could happen is, I think it's really useful for women who might experience these in future, because then depending on how severe it is, you can either come back and speak to your doctor and have a look at the options. And there are options, apart from stopping it altogether, there are options for managing the heavy bleeding, but it's also important to make sure it's nothing else causing the heavy bleeding. And so it's good for us to educate women, and for women to realize that you can come back and speak to somebody about your experience with the Depo. If it's a bleeding problem, let's look into it, find out the cause, look at how to manage it. Of course, coming off the Depo is an option, but there could be other things that could be done, because we're looking again at a contraceptive method that is quite effective. The other thing I should note as well, I know I said we can't predict. For women who've just had a baby, so literally just had a baby, sometimes the bleeding pattern can be quite bad if the Depo is started. Not all women, but there's some women who could experience really difficult bleeding patterns when the Depo is given soon after they've had their baby. Okay, so let us have a look at what's going on in the chat. Say hi to a couple of people, take up some comments. And hi, Dr. Snow. Do you know the average amount of weight a woman might expect to gain when starting the Depo Provera? So that's a great question. I don't have an exact figure, Dr. Snow. Oh, hi, Dr. Snow. I should have said hello first before jumping into the question. Thank you for joining the stream. But that's a great question. It will vary from woman to woman. And I think the guide of a sort of 5% change in weight within the first couple of shots, or within at least the first 6 months or 9 months of starting the method, should guide a woman. Some of the studies I was looking at were looking at about between 5 to 10 pounds, so sort of between 2 and 5 kilograms of weight gain within that first period. But there are women, particular, who can go up to 10 or 12 kilograms or 20, 24 pound gain in weight over using the Depo over a period of a year or 18 months. So it's quite a significant amount of weight to consider for a woman to gain. And here's another comment from Caroline. Thank you. The women who put on weight, do they exercise or weight train? Good point. In those studies, it wasn't specified exactly about what else they were doing, but I think that's a really good point. Thank you for this question, because a few years ago, we used to tell our women on the method that there wasn't really a link between weight gain and the Depo. That's changed now because with the increased experience that we've observed, it's that advice has changed. What we used to say back then was there might be some other factor responsible for your weight gain. And so we used to encourage women to stay on the Depo and then look at their healthy habits. Are they eating right? Are they exercising? So it wasn't, so back then it was simply the Depo doesn't really make you put on weight. It's just that you're eating more. You're not, doing all the healthy things you should be doing to keep your weight down. They don't say that anymore. The studies didn't specify, but I think it's good practice for anyone who's using the Depo to make sure that if you do decide to continue with the method and you notice that you might be at risk of putting on weight, you should ensure that you are eating healthy and taking steps like exercising regularly and weight training to control your body weight. So I think that's how to respond to that one. And then another comment from Dr. Snow. It is so important to warn women of the possibility of their period stopping so they won't be surprised if it happens. Surprises can be unnecessarily scary. Yeah, that's spot on. That's a really important comment to make. I think we probably don't do as well as we should or as we could as clinicians in warning ladies about the possible effects or harmful effects that you could have. I think if we spent a bit of time, and sometimes it's difficult because you may in the context of a busy clinic, you may not have the time to go through all that information. But I think the common things like bleeding issues or weight gain that women might, or trouble with sexual drive that women might experience, I think having that discussion at the start is encouraging. That would help a woman to make a decision, or if she does decide to stay on the method, if anything happens, to come and speak to the doctor as soon as anything happens. So I'm just going to have a quick look. Don't forget, we're running a competition, and it all depends on how many likes that we're getting. So please make sure you're liking. No, we're not at 20. I'm not even sure how many. Let's see if I can find how many we are on at the moment. So let me see. So if you can, please give the... Okay, right. Okay, so we're still working towards 20 likes. So once we get up to 20 likes, then we trigger the competition, and then you get a chance to win those bottles. So don't forget, we're doing a live stream giveaway today, courtesy of our sponsors, nales.org, who are going to be gifting 2 lucky people with fruit infuser bottles. I'll just pop that up again. I just love looking at these bottles. So yeah, so you got the potential to win one of those bottles. For healthy drinks, we need to cut down. So we're talking about things to keep healthy, lose weight and maintain our weight. So these are really useful alternative for drinking fruit juices, because fruit juices can be loaded with so much sugar, and they could also have an effect on your gut health and increase the risk of bloating or cramping. So really useful to have something like this to hand, and it also makes a great gift as well. Okay, so we're going to continue with the other methods that we've got. Before I do that, I'll just pop back into the Bob. Welcome, Dr. Helen from New Wine Platter, another lovely YouTube channel. Make sure you check out a New Wine Platter. Says, agree, really interesting topic, thank you. And then that bottle is calling my name. Absolutely, get people to like. Let's like the video, get up to 20. I want to give away those bottles. Okay, so guys, let's get back into it. So the next one that we're looking at, I think we just did the period. Okay, so Depo Shot after you get off. So this is really interesting. This is what happens after you stop the Depo. Now, I just have to share this. Let me see if I can find it and share with you, because I thought it was really interesting. I just took a screenshot from a comment a lady shared on Twitter about her experience coming off the Depo. So let me see if I can find that for you and share it with you. Okay, no, I've not opened it up, so I need to open it up first. I hope it's big enough for everyone to read. But let me see if I can find it. Okay, so that's that one. So let's share. So hopefully you can see. So yeah, of course, I've hidden her details, but this lady is talking about the Depo. She says she used it for 3 years, stopped menstruating for 2 years, put on a lot of weight, up to 105 kilograms, but wasn't worried. When I decided to stop using it, I became sick, had a fever, nausea, menstruated for 2 months straight. Was a very bad experience. Side effects of it is horrible. So this is somebody's live Depo and post-Depo experience. Now, it's not the same for everyone, but I think it is only fair to look at, particularly if you're talking to somebody who's thinking about starting the Depo, or if you're already on the Depo and you're thinking, oh gosh, what happens after? This is not the experience for everybody. I didn't find the frequency, and actually didn't find reports like this when somebody develops a fever, nausea, and all that. But it's not impossible that this could be withdrawal effects from the hormones. There are definitely features that we know you'd have after stopping the Depo. We know that it can take several weeks, months even, to clear the progesterone. The other thing I forgot to put up the graphic was the Depo. In most cases, it's about 100 to 150 milligram, depends on the particular brand that you're getting. It's a lot of progesterone in that injection. Yes, it's been spread over a period of time, over the period, 12 weeks or 8 weeks, whichever it is that you're taking between injections. But it is a large amount of medicine. If you compare to the oral progesterone pills, where the quantity of progesterone per pill, we're talking about micrograms. So the quantity is quite different. So when you're looking at how much time it takes for it to clear out of your system, you're looking at months, in some cases 14 weeks, even longer, to clear for the progesterone hormone itself, the external hormone, to actually clear out of your system. And we think this is related to why there is a delay in return to fertility and delay in resuming periods. And this is absolutely one of the things that women should know before starting the method, or while they're on the method, that when you stop taking the injection, it's not like the implant or the pill that things could literally bounce back and you could possibly get pregnant within it. Or, for example, if you miss a pill, remember, if you miss a pill, you're encouraged to either go for an emergency contraceptive tablet, or avoid having sexual intercourse, or use a condom, because you've missed 1 or 2 pills. So you see how easily or how quickly your contraceptive protection can be broken. It's different for the Depo shot, because it takes such a long time for the progesterone to come out of your system, and then there's a delay in returning to fertility and delay in resuming your period. So women need to know that. So before a woman starts the shot, she needs to know that, look, if you're going to stop it in XYZ time, you're going to need XYZ time plus another period. It could be months. Sometimes it could be 12 to 18 months for your fertility to return and for you to have a baby, which is what's relevant here. So for women who want to go on the Depo and they're thinking of having kids, so go on the contraceptive for a couple of years and then come off it and have a baby, they need to have their mind prepared. If they choose this method, that it's going to take some time. So please don't worry or get scared that you're infertile or something's gone wrong, the Depo has done something to your system. This is what it does. This is what's expected. But I think we maybe not giving so much of that message out, and so women come out of having the Depo, experience delay in their periods coming back or delay in getting pregnant, and they think the Depo has done this, when this is an expected effect of the medicine. But going back to that lady whose experience I shared, where she had floods of heavy bleeding, she felt sick, she felt unwell. Some people can be particularly sensitive, so perhaps this was her body reacting to the drop in the hormone level, and hopefully for her things eventually settle. But it's a nasty experience, and people need a lot of support when going through something like this. Of course, there's also the risk of bone thinning, which I'll talk about in a little bit, but that's also there. So something to expect, that after having the Depo, yes, it does revert back to normal, because it can potentially have an effect on your bones, but it does revert back to normal. So making sure that you're keeping yourself healthy, taking vitamin supplements, or making sure you're upping things like calcium rich foods, or drinks, milk, yogurt, lifting weights, again, to build your muscle and bone, to help support your bone health, things that can support that, because of the possible risk or effect of the Depo on some women. Okay, so that is the Depo shot. That's what could happen with the Depo shot. Some people might get very unwell, but some people are usually fine with it, but they just should know that they could experience some delays in returning to fertility. So let me quickly go back to the comments from Dr. Sna. I love fruit infused water. It's lovely, isn't it? It's really great. Plus, it's healthy. That's the key thing. It's healthy and tastes good. So who wouldn't love it? It's amazing. Welcome to IB Sam. Thank you so much for joining. Great to have you on board. Right. So let's go back into what's the next question. So we've just talked about Depo shot after you get off, and then next one is Depo shot Make You Infertile. So again, if you're just joining in, what I'm doing is talking about the harmful effects of the Depo shot, or the Depo progesterone birth control injection. And so what I did was I went to look at the most common side effects that women, are worried about or complain about. I checked the internet and social media, came up with a list of different sort of comments that women were making, and is this true, is this not true? So we're at number 7, Depo shot Make You Infertile. And here is this was actually one of the easy ones to go through, and there is absolutely no evidence at all that the Depo shot makes anyone infertile. There's no evidence for that. It is a reversible form of contraception. So that means everything, all the changes that it causes are reversible. It is the introduction of the synthetic progesterone to a woman's system, which when she stops taking it will exit her system. The challenge is in the length of time, which is what I was just talking about a few minutes ago, that there will be a delay in fertility, and prepping women beforehand helps to save that heartache and heartbreak, jumping around, all looking, why am I not getting pregnant? What's wrong with me? What's going on? And so on and so forth. Okay, guys, so let me just quickly have a look and see what we're doing in terms of likes, because there's this competition that we're running. So I'm just trying to see if we get up to, I'm just trying to see if we get up to 20 likes. Oh, we're just on 5 likes at the moment. So hopefully we'll get what, 15 more before the end of this. So at least we can trigger this competition. Okay, so let's carry on. So initial effects of the Depo. So I thought this was interesting and just wanted to quickly go through it. What should we tell a woman? What possibly could you expect when you get your first shot, that first 3 months or first 6 months, first 3 to 6 months? What could happen? Very common complaints, just run through them. Things like headaches. And this is progesterone. So yes, it can cause headaches. Some women could get acne, so skin changes. Some women complain about dizziness. And these are common, because I sort of went through side effects and went through how frequently they were happening. These ones were the ones coming up quite commonly, and sort of early symptoms or early effects that women could experience. There's tummy upset or tummy pain, and feeling nauseous, feeling like vomiting within the first period, feeling very tired, lethargic, exhausted within the first few months of having the injection. Mood changes, and they talked about irritability, anxiety, low mood was also one. Low mood, which I'm going to talk about at length, but irritability was quite common, coming up as a side effect that women might experience within the first few months, first couple of shots of having the Depo shot, as well as back pain or joints, just niggly aches here and there. The thing about the early side effects, a lot of them do settle. It's like starting, it's sort of the same thing we would say when you're starting the pills, that yes, you may have these side effects, things like what's it now? Breast tenderness, or headaches or spots, some of them actually do settle down because your body is getting used to these new hormones coming into the system. So some of them do settle down. So after the first couple of shots, you might find that they stopped happening. And that's the experience for most of the women who are happy with their Depo shot. But of course, there are some women for whom the symptoms do persist. And so it's a matter of looking at what you can tolerate. At the end of the day, it's important to say, I don't agree with manufacturers who say any woman can use this, because yes, of course, they're trying to sell the product, but I think we should be honest with ourselves that not any woman can use this. At the beginning, I went through the list of those who can versus those who can't. And so we have strict criteria for women who definitely can't. And so that's the things that could cause life-threatening problems. So a woman who has a blood clot, for example, we're not going to be recommending the Depo injection for her, somebody who has very high blood pressure. But when it comes to really disabling side effects that could potentially harmful, like the lady who came off the Depo and she was having all those symptoms, that's disturbance to one's quality of life. So that's harmful. That could make her feel, that could put her through a lot of trauma, disrupt her day-to-day activity, disrupt all sorts of things. So that's, for a woman, that's a really bad experience. So I would put that as a harmful experience. So it's not particularly for every woman. And the thing is, you can't determine from just looking at the person's face or their record what effect it's going to have. So really it's about weighing the pros and the cons, deciding there's so many different contraceptive methods available, what options are best for me, and am I able to tolerate or risk this particular method, given that it seems to suit me and suit my style of life. You may be somebody who just can't take tablets. Tablets is just not it. And you may be somebody who feels you just can't have the implant in your arm, or you can't have the intrauterine device or the coil in your womb. And you don't want to have the patch, you don't want to have the ring, but you want a method because you're really concerned about not getting pregnant. And so you're looking at the Depo and thinking about it. The side effects that we're talking about can be in a small group of women, but they do happen in some women. So it's important not to gloss over them, just so that you're aware of them and you can make your decision. You can weigh and choose or make a decision about whether or not you can tolerate it. So Dr. Snow's saying there's no one size fits all medication for any condition. Each person is different and must be treated with their individuality in mind. Exactly. So these methods are there, but what suits you and what suits the next person is not going to be the same. So ahead of time, we should be prepping women who choose this method. This is what could happen. This is what we hope to happen. It has its pluses, yes, but there's some things that could happen, and it's important for women to be aware of them. Okay, so what's the next one? Where are we on now? Let's go back into the questions. Oh, you're going to love this one next. So Depo shot making me depressed. Oh dear. So we've touched on that a little bit already, haven't we? So so yeah, this one is very easy to answer. There is a link between hormonal birth control methods and mood changes. Nobody's going to deny that. They could be things like anxiety, nervous behavior, sort of feeling agitated, emotional problems could develop. I have seen quite a few patients, and this is not just Depo. This is on different types of hormonal contraceptive methods, and it doesn't happen to every woman. But I think, as on our side as doctors, we should also be sensitive to the fact that some women could come in and she's not making this up, and it's not just because she's going through something. It could be the method. I think it's reasonable to sit down and explore and decide whether it is the method that's causing the problem. So on those studies where they were looking at depression, they showed that women who were currently using the Depo shot and those who had just recently stopped it were at a higher risk of depressive mood or low mood compared to those who were not even using it. So some studies have shown that association. Again, the thing about the studies is you do a study of 400 people or a study of 500 people, you might get a result in this particular area. There might be something that makes the result a bit different, that skews the results. There might be something in a particular group that skews the result, and then you get a different result in some other group. They might be looking at women of particular age groups, so they might be looking at women of a mixture of different ages, different cultures, and I suppose we should be looking at other things going on in their lives before you can associate just having the Depo with the depressive symptoms. So I think that's why a lot of the studies, you don't get a conclusive, definite link, but there are studies that suggest that there is association between the mood, low mood, and the and using the Depo shot. Right, so the next one, I found this really interesting, which is why I use this to title this live stream. Depo shot makes me sleepy, because I really hadn't come across it. If I wasn't sort of researching this, I wouldn't have thought about this, because on the contrary, insomnia, I think, is one of the side effects that's listed, but actually having the Depo shot making you feel sleepy was a complaint that someone or some people have had. It's not very common. The Depo progesterone is not known to have sedating properties. And actually, if you go to the Electronic Medicines Compendium and look up the Depo progesterone, it's actually insomnia that's listed. So sleeplessness that's listed as and it's not a common side effect. But when you think about it, we've talked about how it can affect the mood. It's possible that in association with other problems, so in association with other things like depression or other mood changes, it may contribute to excessive sleep. But I just thought I would love if anybody could link me to some study or research. I'm really interested in this. It's obviously not a very common effect, and it will depend on to what extent it affects the person before you can term it as being harmful. But I think if you're going to work and you're not able to work, or you're not able to look after your kids because you're always sleeping and it's because of the Depo, I think that's fairly significant. Okay, so next we're looking at Depo shot makes you break your bones. Let's just have a quick look and see how we're doing. If we've got if we're getting anywhere nearer to triggering this triggering this competition. Okay, we're still below 20. So yeah, so we're talking about now the Depo. Yeah, Depo shot makes you break your bones, or Depo side effects on the bones. So this is another one of those things that causes concern. In the beginning, we said the Depo shot inhibits, this is the way it works, it inhibits ovulation, which is the release of the egg. And along with that, the changes in the body that go along with that are the reduction in estrogen production, that is the body's natural estrogen. All that is shut off because of the progesterone that's coming into the body from outside. That's the injection. So low estrogen means loss of your bone density. In other words, the bones could potentially get thinner. And this is a condition known as osteopenia. And it's more likely to occur in people who are long-term Depo users. And there is a potential risk of fracture. So this is where it comes in quite important. Some of the biggest concerns have been when it affects women, girls and young women who are under 18. And one of the questions is about how appropriate is it to use the Depo because of one of these side effects in women who are under the age of 18 who are looking for methods of contraception. The agreement, and I'm referencing guidelines from the Faculty of Sexual and Reproductive Health in the UK, is that women who are under the age of 18 can use the Depo as a first-line method of contraception if all the other methods have been discussed and they appear to be unsuitable or unacceptable. So it's probably not the first one that you go for if you have a 16 or 17-year-old lady who you want to start contraception, and you've sort of gone through the different methods and they don't seem to agree or suit, then the Depo can be a fallback. But the important thing is that you have to remember that the bones for people under the age of 18 have not fully developed, not fully mature. So there is a risk of injury with long-term use. And so that's why it's not your first choice, but it can be. And the only way to offset the risk is to regularly monitor, to continuously monitor. So particularly, there's no medication, there's no chronic medication that you should start and just stay on it forever, endlessly, without any checks. That's totally inappropriate. But for Depo in particular, it's important that we look at things like your blood pressure, but I think in this particular case, look at the safety of your bones. So there may be need, particularly for those who are at risk, there may be need to do scans to check that the bone density is not reducing. So these are necessary checks that your doctor would do. And the recommendation is that if a woman is on the Depo, her use of the Depo must be checked every 2 years to make sure that check that it's suitable, check that there isn't something that's either safer or that she would prefer, but also check the health impacts. And one of these is the effect on the bones. For women who are over 40 and approaching menopause, and again, the reason approaching menopause is important is because as you approach menopause, naturally, estrogen levels start to come down. And so there is a tendency for thinning bones towards that age and the risk of fracture. The recommendation is that we can still give the Depo shots for these ladies. There's no evidence, according to the studies that have been done, there's no evidence that women in that age group between 40 and upwards, up to the age of 50, there's no evidence that having the Depo injection causes any change to their bone densities. But over the age of 50, we recommend that that's switched to an alternative method. Because of course, you're looking at women who may have reached menopause, and so they already have low estrogen, very low estrogen levels. They already have a risk of experiencing thin bones and fracture. So you don't want them to have to be on a method that further increases that risk. So the key thing is about checking out and evaluating the woman every couple of years while they're on this method. Okay, so let's have a quick look for comments. Nope, that's fine. I think I'm up to date with the comments. Let's have a look at the next question. Pregnant on the Depo shots. Yeah, so this one is about what is the risk that I could, what's the risk of getting pregnant? Well, this is not, yeah, well, you can call it a side effect because it's the failure of the Depo. But yeah, this is just a quick one about what is the risk of getting pregnant. So, well, the thing is, it is not 100% pregnancy proof. There is a possibility of an unintended pregnancy while on the Depo. That is possible. I know I've come across people who have been caught out while on the Depo. They've not missed their doses. They've ticked the box, come at the right time to have their injection. But it does happen. And what the studies we have tell us that when you're taking the Depo consistently at the recommended interval, so if it's every 8 weeks, you're showing up for your injection, or it's every 12 weeks, you're showing up for your injection, the failure rate is described as only 0.2%. So actually 2 in 1,000 pregnancies. So only 2 women who are using it. So out of 1,000 women using the method, only 2 could fall pregnant. And that's just the failure rate. But this is perfect use. But with typical use, which is, life gets in, some things happen, you miss your appointment, you miss your dose or whatever it is, the failure rate can increase to 6%. So that's 6 out of 100 pregnancies. So it is possible to get pregnant on the Depo shot because that is just the nature. It's not 100% guaranteed and it could happen. Okay, so let's have a look. What have we got? Yeah, we've got another one on hair loss and Depo Provera. And this one, again, is another one of big concerns because some women are worried about losing hair or thinning hair. So either the texture of the hair changing, so hair changing from being thick and lustrous to thin and brittle, or actually hair falling out. Hair loss on its own is a feature of many hormonal methods, including the Depo. And can be a reason for a woman to say, you know what, I'm not going to continue this method, even though the method is otherwise good. The thing about the hair loss is it's the change in the hormone level which your body is trying to get used to. It's that change that causes that leads to the hair loss or the change in your hair pattern or the features of your hair. It can happen 3 months after starting or stopping birth control. And some women who are particularly observant may notice that after stopping the pill, if they've been on a method for a good number of years, they may notice a change after they've come off it. Because yes, it can affect the quality, the texture of the hair. If you're on the Depo Shot, what the studies are suggesting, if you're on the Depo Shot and you begin to have hair loss, it can continue. When I say hair loss, I mean a change in the texture of the hair, thinning or loss. It can continue for up to 3 months and then stop. So without doing anything, without stopping the Depo, without doing anything, it can actually settle down. Just that takes that period of time. But I think what commonly happens is, particularly if it's not something that we discussed with you discussed with your doctor, if we hadn't spoken to you about it, then of course you'd be keen to just stop this method. Well, the problem with stopping it is that can also trigger a change in the cycle of hair loss. So what I mean is, let me try and explain this. So starting the birth control method, starting the Depo Shot, can trigger a change in the pattern and the texture of the hair. That change usually goes on for about 3 months and then it stops. Your hair starts going back to normal. So what we're saying is that if there are no other issues, sticking with the method for 3 months, and if about 3 months, things will start to get back to normal. But if you decide that because, oh my goodness, I'm losing losing my hair, the quality is changing, you stop the method. Stopping it at that point could also cause the hair loss, the change, to persist for another few months. So you could, by just stopping the medicine abruptly, might actually cause the hair loss or the hair changes to be present for a lot longer than if you just sort of stuck with it for a few more weeks and let it run. Now, this might be controversial for some people, and as a woman, it depends on how much hair that's lost. I totally appreciate if your hair is falling out in clumps, and that is not common. But if you notice there's a difference to the texture of your hair and you feel this is not tolerable, of course, an option is stopping it. But what the studies show is that it's not permanent. It does stop. The hair cycle, the normal hair growth altogether will return to normal. It can take some time. Remember that the thing that we said about the Depo in earlier, we said it can take some time for the normal features and things to go back. So it's to go back to normal. So it might take anything up to 8 or 12 months for it to happen. But so to summarize, there is a link between the Depo Shot and hair loss. This is why it happens, because of the introduction of the hormone. Stopping the hormone abruptly could just make the loss worse temporarily. And if it does happen in any case, it's not permanent. It will go back to normal. Right, so let's have a look at, and this is the last one. Oh, okay, I've got a couple of comments here, so let's see. I think, okay, so is there any risk to the baby if a woman becomes pregnant while on Depo Provera? So there is no. Well, of course, the most important thing is to make sure before giving the injection, starting it or continuing it, that a woman is not pregnant. So standard is, like I said at the beginning, the first 1 to 5 days of the cycle. So while you're on your period, usually is the best time to have the injection. So that is usually a backup to make sure you're not pregnant. And if you're not having your period, then a pregnancy test to make sure you're not pregnant before the injection. But we don't have any evidence that there is significant risk to the baby from having the injection. It's not recommended, of course. And I don't think it's something that's quite so common as an experience in terms of harm to the baby. Then next comment from New Wine Platter is enlightening. That's true. And IB Sam says, oh wow, my hair, this is insightful. Okay, so getting some agreement about that. So okay, so yeah, these are great questions. Keep them coming. So important thing is, if a woman make sure the woman is not pregnant. While there are no, oh, let me just take this off just a second. While there are no obvious Okay. While there are no obvious effects on the baby, if a woman falls pregnant, there's been no obvious harmful effects noted to the baby. So women have had the Depo, and I'm pretty sure I've come across a couple of them like this who got pregnant on the Depo and there were no harmful side effects to the baby. So that's personal experience. But again, going back to studies, no such effects with being on the Depo and falling pregnant. Okay, so I think this is the last one. Depo shot and cancer. This is a big one. This is a really, really big one. So I'm just going to, there are just 3 main points that I want to make so that we're not packing in too much information. Number 1, there is a very small risk of breast cancer with a current use of Depo shot or the Depo injection and breast cancer. There's a small risk. Now, so it's something that one of the things that you discuss when you're doing the counseling about having the injection or having this method is look at the risks of cancer, but it's a very small risk. And we're talking about sort of less than 1%, and associated with a woman who is currently using the Depo, because that risk reduces back to the same as everybody else when she stops using the method. So that's for breast cancer, that is a very small risk. Number 2, there's a small increased risk of cervical cancer in a woman who's been using the Depo for 5 years or longer. So if somebody who's been using the Depo for 5 years or longer, there is a small increased risk of cervical cancer. The risk, again, goes down after she stops taking it. So when I say it goes down, it goes back to the same as everyone else. So if you look at what is the risk of people, of 500 women of developing cervical cancer in a population, the person who's using the Depo shot may have a slightly increased risk 0.2 or 0.3% higher compared to the other person if they've been using the Depo shot for longer than 5 years. This is for cervical cancer. And when she stops, her risk goes back down to the same as everybody else who was not using the Depo shot. So one of the important things about using the Depo shot before you have it is, have you had, or do you have an up-to-date, or are you having up-to-date cervical screen, cervical smears? Really important. And remember at the beginning, I mentioned having, if you have an abnormal vaginal discharge, these are things not to ignore. Bring them to the attention of your doctor. Also reduce the risk that are associated with developing HPV, that's human papilloma virus infection, which we know is linked to developing cervical cancer, and that includes smoking, several sexual partners, not using condoms, things to keep yourself. Oh, and of course, the HPV vaccine, if it's available, you should have that to reduce your risks. But in terms of what you should know about the Depo shot, now these are very, very small risks associated of developing breast cancer or cervical cancer. So they don't come in the common side effects. They are rare side effects. And so you're talking about the experience of 1 or 2 in thousands or hundreds of thousands actually developing them. By no means should any woman decide that, oh, because of this risk that we've talked about here, I would not have this, because there are so many different things that you might use, or so many different treatments that you might use that do have this risk. But it is there, and women should know, so that we make our own individual decisions about whether or not it's suitable for us. And the third point I wanted to raise about the Depo shot and cancer is that the studies suggest that it is not associated with an increased risk of ovarian or endometrial, that's womb cancer, and it may offer some protection. So there's that to keep in mind, that it can protect against ovarian or endometrial cancer, and it does not increase the risk of it happening. Right, so I thought we could cover this in less than an hour. I was trying to run through it, but those are the points I picked up, and I thought it was useful to just sort of go through the different points, go through the many different concerns. There's so many areas I've not touched upon that women could experience from using the Depo injection. The concern about whether it's good or bad, again, it's not for every single person, and everybody has a different medical history, medical background, and those are the things that we should be using to determine whether this method is suitable for you or not. Okay, so just one final quick look for comments. If you have any comments or questions, please add them in here, so I'll round up. And I'm just going to have a quick look to see what's happening on our the likes this afternoon. So I think we're still staying at the same number of likes. So unfortunately, we didn't get to the 20 likes during the live stream. So that's my target for next week. We're not going to give up. We'll see if we can do any better next week and get an opportunity for somebody or some lucky people to win the prize, win this free gift of the infuser bottles. So make sure you let your friends, make sure you let your family know we're doing these Friday giveaways. And if you go on to visit nalis.com, they've got loads of really lovely, amazing products. So make sure you check them out. But we are doing this promotion for them for the next, I don't know how long, but for the next few Fridays, there will be some giveaway or the other. So if we can get the likes to trigger the competition, we shall definitely do so. Okay, so thank you so much, guys, for watching. I appreciate your time. Don't forget to subscribe to the channel if you haven't done so already. We share a new video every Tuesday, and we have these Friday live streams to cover topics like this. We just sort of have a bit of a discussion, share ideas, and share comments and thoughts about it. If you do have any questions on the topic, let me know. So from Dr. Snow, great presentation. Oh, thank you so much. Thank you so much, Dr. Snow, for the questions. Really good to have that discussion, and helps us to share knowledge. I think it's useful for anybody who's watching on replay. So thank you so much for joining. I really appreciate. And New Wine Platter says drop the link. Which link is this for? The is it Nalis? I think it's Nalis. So let me just put that on. But I think it was on the it's nalis.com. If that's what if it isn't, let me know the next couple of minutes before I shut down. But that's the link. So let's give her a couple of seconds to make sure that was it. That was everything. Yeah, so videos Tuesdays and Fridays. And obviously follow us on our social media channels, Instagram. Okay, yes, for the bottle. Yes, nalis.com. Absolutely. So yeah, it's on the website. But again, I'm going to bring this back next week, Friday, because I'm determined. I've kept the question back because I wanted us to meet the challenge of getting our first 20 likes. But we're growing, so I think we'll do a lot better next time. But you guys have been fantastic. Oh, I've got a message from, hi, Dr. Uchenna Akujobi. Thank you so much for joining. Says, thanks a lot, Doc. Very informative. Thank you for joining in. Appreciate your comments. So guys, you've spent an hour and 8 minutes with me on a Friday afternoon or Friday, whatever time of the day it is where you are. I really, really appreciate it. So I'm going to wish you a very great weekend. Stay well, stay safe. IB Sam says, thank you, Ma. You're very much welcome. Thank you so much for joining. So you guys stay safe and stay well. Till next time, have a lovely, lovely weekend.